If you are over 60 and you take medication every single day, there is something happening inside your body right now that your doctor has almost certainly never mentioned to you. Not because they do not care, but because a standard appointment simply does not leave time for the conversation that actually needs to happen. The medications you are taking to protect your heart may be quietly depleting the exact things your heart needs to keep functioning properly, and the result shows up as fatigue that never fully lifts no matter how much you rest, muscle weakness that gets blamed on age, mental fog that creeps in so gradually you barely notice it at first, a heart that is working harder than it should be every single day because the fuel it runs on is being drained away by the very pills meant to help it. Today, we are talking about 5 specific medications that millions of adults over 60 take every single day and what each one is quietly taking from your body at the same time. This is not about stopping your medication. Please hear that clearly. This is about having a more complete conversation with your doctor, one that most people never get the chance to have. I am Wesley Harper, and if you take medication for your heart, your blood pressure, your joints, your stomach, or your bones, please stay until the end of this video, because the information in the next few minutes is the kind that changes how you manage your health from this point forward. Drop a comment right now and tell me how many prescription medications you take every day. Just the number. I want to know where this community stands, because what I am about to share affects far more people than most realize. Before we get into the 5 medications, I want to explain something important about why this matters more after 60 than it did at 40. When you were younger, your body processed medications efficiently, your kidneys filtered them quickly, your liver metabolized them well, and your overall system had enough reserve that the side effects of one medication rarely created a serious problem. After 60, every one of those systems works more slowly. Your kidneys filter at a reduced rate. Your liver metabolizes drugs less efficiently. And most older adults are not taking just one medication. The average person over 65 in America takes 4 to 5 prescription drugs simultaneously. Some take 8 or more. Each of those drugs was tested and approved individually. What happens when you combine 3 or 4 of them inside a body that is already working harder than it used to? That question almost never gets answered in a standard appointment, and the consequences of it going unanswered show up as symptoms that get dismissed as simply getting older. Let us start with the first medication, and this one affects roughly 1 in 3 adults over 65 in this country. Statins, atorvastatin, rosuvastatin, simvastatin. If you have been prescribed one of these for cholesterol management, you are in very large company. And statins do save lives in people with established heart disease. That evidence is clear, and I am not questioning it. But here is what is buried deep in the information most patients never see. Statins work by blocking a specific pathway in the body that produces cholesterol. The problem is that same pathway also produces something called CoQ10, coenzyme Q10. And CoQ10 is essentially the fuel your heart cells run on. Think of it like the oil in a car engine. Without adequate oil, the engine runs rough and wears down over time, even if everything else is working correctly. Research has shown that statins can drop CoQ10 levels in the blood by 30 to 50%. That is a significant depletion of the exact nutrient your heart depends on most in an organ that never gets a day off. And the symptoms of that depletion, fatigue that does not respond to rest, muscle weakness, mental fog, and measurable reduction in heart function in some patients, are often dismissed as normal aging rather than connected back to the medication causing them. Here is what makes this even more frustrating. CoQ10 testing is not standard practice. Most doctors never check it. CoQ10 is available over the counter without a prescription. It cannot be patented. There is no financial incentive driving anyone to routinely add it to the standard protocol for statin users. The question worth writing down and bringing to your next appointment is simply this: should I be taking CoQ10 alongside my statin? Not should I stop my statin? Just that one question. Research suggests 100 to 200 milligrams of CoQ10 daily may meaningfully support heart function in people taking statins long-term. Ask your doctor if it makes sense for you. The second medication on this list does not look like a heart medication at all, and that is exactly what makes it so easy to overlook. Anti-inflammatory pain medications, ibuprofen, naproxen, these are sold over the counter. They are cheap. They are in almost every medicine cabinet in America. And most people taking them every day for joint pain or arthritis never think of them as something that could affect their heart. But here is what the research actually shows. These medications work by blocking certain enzymes in the body. One of those enzymes is responsible for producing a compound that keeps your blood vessel walls flexible and prevents dangerous clotting. When you block that enzyme, you remove one of your body's natural protections for your cardiovascular system. At the same time, regular use of these medications raises blood pressure on average by 3 to 5 points. That sounds modest. But in an older adult whose artery walls are already naturally less flexible with age, that chronic pressure increase accumulates over months and years in ways that raise stroke risk meaningfully. The FDA placed a specific warning on these medications regarding heart attack and stroke risk. That warning is on the label right now. But it rarely comes up when someone grabs a bottle off a pharmacy shelf for their knee pain. If you are taking these medications daily for chronic pain, there are alternatives worth discussing with your doctor. Topical anti-inflammatory gels deliver similar relief directly to the painful area with dramatically less absorption into the bloodstream. Omega-3 fatty acids at meaningful doses have solid research behind them for chronic inflammation. Ask your doctor what options exist for managing your pain with less cardiovascular burden. Now, the third medication is one that most people never in a million years would connect to heart health. They buy it without a prescription. They take it with their morning coffee. They have taken it for years without a second thought. Proton pump inhibitors for acid reflux and heartburn, omeprazole, pantoprazole, lansoprazole. Roughly 15% of all American adults take these medications. Many have been taking them for years, some for over a decade. Here is what most people are never told. Your stomach acid is not just causing heartburn. It is doing an essential job. It is required for your body to absorb vitamin B12 properly. When you suppress that acid long-term, you block B12 absorption almost completely. Now here is why a heart health video is talking about B12. Vitamin B12 is essential for processing a substance in the body called homocysteine. When B12 is low, homocysteine builds up in the blood, and elevated homocysteine directly damages arterial walls. It is an independent risk factor for cardiovascular events that is comparable in some research to high cholesterol, and yet it is almost completely ignored in standard checkups. Research has found that long-term users of these acid medications have B12 levels significantly lower than non-users. And this is happening on top of an age-related decline in B12 absorption that begins naturally after 60, regardless of medication. A medication-induced deficit on top of an age-related one creates a combined effect that can become serious over time. These same medications also deplete magnesium, and magnesium is involved in over 300 processes in the human body. For the heart specifically, magnesium regulates the electrical signals that keep your heartbeat steady and consistent. Low magnesium is directly linked to irregular heart rhythms and muscle cramps that wake people up in the middle of the night. If you have been on one of these acid medications for more than a few months, ask your doctor to check your B12 and magnesium levels. Ask whether there is a plan to eventually taper off the medication rather than staying on it indefinitely. And if B12 supplementation is appropriate, ask about methylcobalamin taken under the tongue, which bypasses the absorption problem that the medication itself creates. Let me know in the comments if you have been taking one of these acid medications for years and never had your B12 or magnesium checked. I think the number of people in that situation in this community is going to be significant. The fourth medication is one that prevents dangerous blood clots in millions of older adults and does that job genuinely well. But it has a consequence that almost nobody discusses with patients: warfarin, one of the most prescribed blood thinners for older adults with atrial fibrillation, deep vein thrombosis, or mechanical heart valves. It works by blocking vitamin K to prevent clotting, and for stroke prevention in atrial fibrillation, it is genuinely important medication. But here is what gets missed. There are two forms of vitamin K in the body. Warfarin cannot distinguish between them and blocks both. One of those forms, vitamin K2, has a specific and critical job that has nothing to do with clotting. Its job is to activate a protein that prevents calcium from depositing in your arterial walls and directs it toward your bones instead where it belongs. When warfarin blocks K2 along with K1, it removes the body's primary defense against arterial calcification. Over time, calcium that would have been directed to the bones instead settles into the walls of blood vessels. The arteries gradually become stiffer and more rigid, less able to handle the normal demands of blood flow. This process has been observed in research comparing long-term warfarin users to patients on newer anticoagulant medications that do not have the same effect on K2. This does not mean stopping warfarin. Untreated atrial fibrillation carries a significant annual stroke risk. That is not something to dismiss, but it does mean asking two specific questions at your next appointment. First, given the options available today, is warfarin still the best anticoagulant choice for my specific situation? Second, has anyone ever measured my coronary artery calcium score to understand what is actually happening inside my arteries right now? That second question in particular is one of the most underused and valuable conversations in heart health for older adults. A simple low-radiation scan gives a precise picture of arterial calcification that changes treatment decisions significantly. Most people have never had one and never been offered one. Now, the fifth medication is the hardest one to talk about, not because it is complicated, but because it has been recommended so routinely for so long that questioning it feels almost counterintuitive. Calcium supplements. If you are a woman over 60, there is a very good chance. At least one doctor has told you to take calcium for your bone health, i.e. 1,200 milligrams a day. Take it with food. It has been one of the most standard recommendations in medicine for older women for decades. It feels like common sense, but research published in a major medical journal examined 15 randomized controlled trials involving nearly 12,000 patients and found that calcium supplementation without vitamin K2 and vitamin D3 was associated with a meaningful increase in cardiovascular event risk. Here is the mechanism that explains why. When you take a calcium supplement, the calcium enters the bloodstream as a sudden concentrated surge. Your body is not designed to process that much calcium arriving at once, and it does not always know where to send it all. Some of it ends up depositing in arterial walls, rather than going to the bones where it was intended. The calcium you took to protect your bones ends up hardening your arteries instead. And because this happens gradually and silently over years, nobody connects the supplement to the cardiovascular consequences that follow. Why has this not been more widely communicated? Changing a recommendation that has been given to tens of millions of patients for 20 years is institutionally complicated. There are industries built around calcium supplement sales. It is far easier to quietly add a footnote to the guidelines than to clearly say the standard recommendation was incomplete. If you are currently taking calcium supplements, do not stop abruptly, especially if you have documented bone density concerns. But bring this question to your next appointment. Should I be taking vitamin K2 and vitamin D3 alongside my calcium? The evidence strongly suggests that K2 helps direct calcium to the bones and away from the arteries. D3 supports proper calcium metabolism. Together, they change the risk profile significantly. Dietary calcium from food, dairy, leafy greens, small fish eaten with bones is always preferable to supplements when possible because it enters the body gradually, rather than as a sudden concentrated dose. Supplements should fill the gaps in what food provides, not serve as the primary source. So let us bring everything together clearly. 5 medications that millions of older adults take every single day, and what each one is quietly depleting or disrupting at the same time. Statins, depleting CoQ10, the fuel your heart cells run on. Anti-inflammatory pain medications, removing your blood vessels, natural protection, and quietly raising blood pressure. Acid reflux medications blocking B12 and magnesium, both essential for heart rhythm and arterial health. Warfarin interfering with K2 and allowing calcium to deposit in artery walls. Calcium supplements without K2 and D3 potentially calcifying the very arteries they were never meant to affect. None of these medications are villains. The doctors who prescribe them are not making mistakes. These are important medications that help millions of people. The problem is a system that does not have time to cover what each medication takes away alongside what it gives. You can change that for yourself with one simple habit. Before your next appointment, write down every single medication and supplement you take, every dose, every timing. Then, write 3 words at the top of that list. What am I losing? Take that list into the appointment and ask your doctor to go through it with you. Not just what each medication does, but what each one depletes or interferes with over time. That conversation is the one that changes outcomes. That is the conversation most people never get to have. And you now have everything you need to start it. If today's video helped you, please give it a thumbs up and share it with someone you love who manages multiple medications every day. It could be the most useful thing they watch this week. Subscribe if you are not already part of this community. Every single week, I bring you honest, practical health information built specifically for adults over 60. And leave a comment below. Which of these 5 medications surprised you the most? Or tell me what question you are going to bring to your next doctor appointment because of what you heard today. I read every comment, and your response genuinely matters. Take care of yourself and take care of your heart. It has been working for you every second of your entire life without ever stopping. I will see you in the next one. Just remember, this video is for educational and informational purposes only. Always talk to your doctor or healthcare provider before making any changes to your medications, supplements, diet, or health routine.